Let's open this meeting. The first item is the review of the minutes from the last meeting on May 13th. Extensive notes. Thank you, Jane. Any comments on those or a motion to approve?
I make a motion to approve. Thank you for the comments. I actually forgot that we talked about some of that. So that was really good.
We have good meetings. We do.
Yeah.
Okay.
Well,
I
and
have
I
a
felt
motion.
like that was, I felt like it was especially important to capture that because it is like history in the making of how we got there. So I'm really trying to cut down on my detail. I don't actually like detailed minutes, but we're doing so much work every time that it's hard to know what to leave out. So.
Right. Okay, I have a motion. Is there a second?
I'll second.
Okay, moved and seconded. Any further discussion? All those in favor, we only have video, so we can all raise our hands and be counted. Great, thank you. I think that's certainly sufficient, if not, in fact, unanimous.
I was supposed to do a roll call vote, but I think hands are fine too. Whatever.
Oh, if you want, we can.
That's fine.
Okay, thank you. The opioid settlement subcommittee update. There was a meeting yesterday. I'm going to ask Jim to report on that. There are a number of actions that we've agreed to take, and I think we're making progress.
Yes, thanks, Madam Chair. And I want to thank everyone that's joined today, including Mary Beth Mitz from the Lennox Select Board. So to do a quick recap, this is something we talked about extensively at the last collaborative meeting, and it's really about, what is there an opportunity for South County towns to potentially pool their opioid settlement resources that will make the most impact on our residents. And so what had happened was, I think Smitty approached State Representative Smitty Pignatelli had approached Deb, who then approached the collaborative to see if there was an opportunity for the collaborative to facilitate a discussion to see if that would make sense for all of South County to in a way pool the resources together, because you look at all for like Mount Washington where it's like nominal dollars, what are they going to do with a few $100s, where like on the other side of the spectrum, towns like Richmond and Great Barrington, Lee and Lennox are getting a lot more money. And it's really like, what can we do that can make the most impact on those affected by the opioid epidemic and those and their families. And so the collaborative, kind of took on that discussion at the last meeting, and it was really to facilitate kind of like a conversation, to see like where we're going to go on that. And it was a lively discussion. It's in the minutes, it's in the recording. And so the outcome of the last collaborative meeting is that there was a vote to put together a small working group. It was Pat, myself, Ellie, Rebecca, and to just have a conversation kind of quietly to say, okay, what are we thinking? And Gary Pratt from the Rural Recovery Center is also on that. It was really like, okay, what's the role of the collaborative? Because we don't really control the purse strings. We can only advocate and put an ask together. So we were sort of going down a thought processes of like, could we craft a specific ask that would be sent to every town, be specific in what the money would be used for. And then yesterday we had another meeting, which Smitty came, and we engaged into a further conversation about, hey, there's a lot of conversation happening here. Is there a way for his district, which actually includes Beckett, which would be 15 towns now, can we pull together briefly all the town administrators in that town and engage a conversation to say, look at, this is 15 years of funding. Can we pull all our resources together that we can just put to a program or an organization that's actually doing this kind of work? And so and I'm going to be meeting with Mary Beth on Monday, and I'll update you again, Mary Beth, on kind of like where we're at. So over the weekend, I'm going to craft together an actual email with a Zoom link, and it's going to be the 24th at 9 a.m., even though nobody knows about this yet. And it's really to pull in all the town administrators or select board chairs to like at least let people know what we're thinking and see if it makes sense. And I think some of the conversations that came out yesterday, and again, this is no decisions have been made. You know, Tri-Town could be the conduit where we could set up an intermunicipal agreement, kind of like the household hazardous waste program, where like we would collect all the dollars on an annual basis, help with the reporting and give it to an organization and let towns know. Those are just thoughts and ideas. So I think some of the smaller towns that don't have administrative staff will have a hard time understanding where to send their dollars to, including reporting. And so the goal is to have a meeting, engage the right people, let them know what we're thinking, because we haven't approached the select board yet, because we're still kind of like having an ideal conversation of what makes sense. And I don't want to go to Mary Beth and others without the ask. And so I think we're moving in that direction. Hopefully, I think it would make the most sense. I know other towns are thinking different things, but like me personally, this is only me speaking. I think the Southern Berkshire Rural Recovery Center covers all of South County. They're doing so much work, boots on the ground kind of thing. And they're already doing this kind of stuff. Our residents are already going there. And so if it were me, I would love to advocate that, you know, our Tri-Town town dollars go to something like that. But again, we can only advocate. And if the town feels like they want to do their own thing, I think we can only try and see if they're willing to do it. That makes the most sense. And then kind of go from there. So that's where we're at. We're going to have another brief follow-up meeting with Smitty in a couple of weeks. In the meantime, we're going to try to pull together some local data if we can. So if, you know, like Lee asked, like, well, why Lee? Well, here's the number of opioid related deaths that we've seen in Lee, in Lenox. And I know some of the data is very complex. And so again, I think we're just engaging in a conversation because the money I think is coming like really soon. And I think towns are like, what are we going to do with this? So I think the collaborative in whole is willing to advocate and try to help navigate to see if it makes sense for South County.
Right, and Smitty also made the suggestion of a possible change in how the money is distributed. Maybe eventually it would be too quick for the allotment that's apparently coming in June and again in July to catch up with the payments. But the idea of having the payment made directly to some source, such as the Tri-Town Fiduciary Group, so that it wasn't everybody writing checks and having to deal with it. But one of the things the committee is concerned about is that how the money is moved around is going to be an issue for people, and that's going to stop them perhaps from really engaging in the use of the money. So we want to be sure we have some proposal there that can answer that question, not just how it's going to be used, but how it's going to be reported on and how it's going to be handled.
Yeah. And I mean, I have some ideas, but again, I don't want to be the only voice in the room to offer a suggestion. But like the fiduciary host for Tri-Town is the town of Lee, and if the town of Lee is on board, we could do something similar, and that's if everyone's willing to do that. Where you know, it's just we can sort that out later on, but we need to sort that out at some point to make it easier for towns. And I think, you know, one of the ideas was like throwing together an intermunicipal agreement with the parties, right? So they know like where the money's going, how it's going to be spent, and what the roles and responsibilities are for the parties. And it's just an idea. Oh, here comes Smitty now. It's just an idea, but you're right, Pat. It's like this town A is going to get a check. What are they going to do with it? It becomes this thing. And I think what the goal is to streamline. And from my perspective, for the towns that I serve, is I just want to make sure that the money is being appropriately spent to an organization or whatever that's going to get the most impact for the community.
Right.
That's what I care about in my heart. It's just like I hate to see like a town buy a bunch of Narcan supplies and it sits on a shelf. Right.
Ellie, you have a question? Or
Yeah, no, it's not just a question, it's a bit of a comment. Part of my question is that this allotment that is coming in June, is this for fiscal year 2022 or fiscal 2023?
22, apparently. 2020.
If it's for 2022, then they're giving us literally 2 weeks to spend it. So I think that somewhere along the line, and maybe this is something for Smitty to look into, is that that's really not reasonable. We can't even get an ask going for that. And I think that legislature needs to, they need to deal with that. My other comment is, hello?
This is Rebecca.
Yes.
Sorry, I'm calling over. So I just wanted to say that you can defer the payments that come in June to fiscal year 23.
How do we go about doing that? Because that has to be part of the instruction for this meeting that we have literally on the 24th of June. So we need to be able
I
to
don't
tell.
know how you go about it, but I do know that you can defer the payment.
Right, but my point is that if we are going to be talking to people, we have to have that information there and say, look, you're going to be getting, and you may have already gotten this payment. This can be used in 2023. Here's where you need to go to find out about how to do that. Because the end of the year is a really rough time for towns to have to sort of put this kind of stuff together. So we need to help them out with that.
Mary Beth, you had a comment?
Yeah, the AG's office did a presentation a couple of days ago during the opioid, there was an opioid discussion and a presentation given. And they talked very specifically about payments 1 and 2. The payment 1 would be coming in fiscal year 22, but you could accept it in fiscal year 23. The second payment could be accepted in 23, and there were going to be payments 3 and 4, probably in January. So there would be 4 payments coming during fiscal year 23, and that there was acknowledgement that the AG's office was trying to tell people to accept it all in fiscal year 23. So I think that there's going to be some forgiveness with regard to that first payment coming in, as long as your fiduciary agent in town, accepts it and credits it to fiscal year.
Exactly. I understand that I understand that whole conversation is going forward. What I am trying to get across here is that we need to be prepared to be very specific with people about how they go about this, because they were not all at that meeting. And what is happening is that they get to a meeting, they are very pressured at the end of the year for all of these things. And there's a lot of things that they actually have to defer payments through the first part of July, et cetera, et cetera. So we need to make sure that their treasurers are comfortable with having the information right there, so we can say, and this is how you go about it, or this is where you go to find out about it. That's really what I was trying to get across.
Right, Ellie, I think that that's an issue for that subcommittee to be sure. That subcommittee is all on this call, so I think we hear what you're saying.
Right, but that subcommittee meeting is on the 24th of June. So these meetings are taking place now, all right? And the other part that I wanted to bring up was, and I think our recipient choice here is, I agree with Jim. I think that this is a great group to be doing this for. But one of the things that they are going to have available from the get-go is how they will spend this money. Because I know for a fact that that is going to be a question from our board, and they are going to not want to hear, oh, we're going to put it towards, some nebulous thing. If they want to be using it for their utilities, which is what he was mentioning,
Rent
they need to be upfront about that and let people know. I'm just trying to get everybody to understand that we've really been talking about this, and there's a lot of anxiety with the fiscal stuff because of the way stuff happens, but they're overloaded. This is not the only program that's doing this. So if we want to get our ask out there, and we want to get it positively received, I want to make sure that we have that information for them. So that's all I wanted to say.
Good, thank you. Are there any other comments? Smitty, did you wish to weigh in on anything?
No, I'm good. The meeting yesterday was great, and I just think pooling our resources to get a bigger bang for our buck is going to be critically important in this effort. So let's not spend the money on frivolous things. Let's get it to be something really substantive, helping people in these tough times.
Great, thank you. I think we may need to at least have a phone conference or another little Zoom meeting based on Ellie's comments to be sure that we are collecting the information, not just the statistics, but the mechanism in terms of dispersal. So we'll leave that to the subcommittee. Any other questions on that topic? A lot going on, clearly. Thank you. New topics for discussion, the PHE Training Hub. Who's got that one? Jane or?
Yeah, so we were made aware of a training hub possibility. So right now the Public Health Excellence Grants and what DPH is doing is they're looking for 10 training hubs throughout the Commonwealth. And so right about the time that this agenda was getting posted. And so we just weren't sure what the process was for requesting information. And we wanted to make sure that our collaborative has actually a pretty deep bench of people with experience. And we just wanted to make sure that if there were an opportunity for us to have resources to train each other, that we wouldn't have missed out on that. So we still haven't gotten a lot of specific information about what the training hubs are, and certainly, you know, to put our hat in the ring to become a training hub. It was part of a survey, and it was very, it wasn't the most transparent process, but we just, again, we were putting together the agenda and wanted to talk about it and just make everyone aware that that's something that this DPH is looking at. And, you know, we just hope that if there are resources for mutual training, that possibly we could have some access to that to help pay for staff time. Like, for instance, you know, Ellie's about to be done getting trained in the FDA standardized food inspections, right? So there might be some opportunities for us to cross-train with other towns. So Jim, do you have anything that you wanted to add to that?
No, not really. It's just, it was a really confusing process where there are many public health excellence grantees across the state now. I don't know how many, but there's like 40 plus, and there's a significant need because people are trying to recruit and hire staff, which takes a lot of resources to do. And then DPH just said, well, we've already handpicked 10 training hubs and no one knew anything about it. And what I really care about is that we have access to that. In addition, you know, obviously we're going to advocate as a collaborative because, as Jane mentioned, you know, a primary foundation right now is public health nursing, but we're already tapping into other realms as we evolve as a collaborative. Like if we inventory what we currently have, there's a lot of qualified staff kind of spread out through the collaborative. And I just want to make sure that we're advocating for ourselves that, you know, if we get the resources, we can cross-pollinate each other and build our own capacity rather than putting our name on a list and waiting for someone else to come out and train us. So that's not really benefiting us as a region long-term. We have the skill set, we just don't have all the resources to, you know, to kind of navigate that. So I don't think it's a collaborative ask or vote today. It's sort of like an update. It's just, you know, we need to make sure that we're bending DPH's ear. You know, is if we want these public health excellent collaboratives to be successful, you gotta give us the resources to make it successful.
Right, which will lead to another point later in the agenda. Thank you. Item number 4 are program updates. I hope the IMA is a done deal, right?
We're super close. We're like at the 1/2 inch yard line before we score a touchdown. So we're just the Great Barrington Board of Health just needs to sign off on it. We gave a presentation a couple weeks ago. Great Barrington Select Board endorsed it. It's just, we're just about there. And once they sign off on it, we'll put it all together. We'll get it out to the clerks, or we'll make it official. So we're just about there.
Great, terrific.
Hey, Jen, does this have to be a vote, or can they just sign it individually, the Board of Health?
So Some towns,
'Cause they're
the
gonna
chair
meet
signed,
next
some towns, the
Thursday.
chair, some towns, the chair signed off on it. They didn't put it in front of
Okay.
the entire select board. I think that would be up to your chair to make that decision. But we have had a lot of towns chair just sign off on it.
Okay, that's good to know because I'm gonna set the agenda for Tuesday for a Thursday meeting. So
Yep.
I will run it by Michael. Thanks.
Thank you.
Okay, opioid work, sharps, medication disposal, etc. Jane, I presume?
Yes, yes. So this has actually been kind of an exciting week, or not week, but month, opioids. We have found our vendor and are just waiting for the sharps containers or the sharps receptacles to get a quote on that. And we're hoping to get it in right at the end of this fiscal year. We did shave quite a bit on shipping by like looking at ordering 3 of the receptacles. We're looking at outdoor receptacles. And we have found a vendor that's really easy to work with. So they come and they just have a key and they come and they pick up the sharps, and it's a outdoor container, so it's waterproof. So I'm looking forward to next year reporting the success of the program. We're working on signage and just making sure that it fits the needs of the town, and also looking for different funding sources to provide sharps containers as we roll it out this year. So that's been pretty exciting. And I know it's something that Rebecca has actually been really enthusiastic about this. How many years has it been, Rebecca? Like 5? And so it's just exciting that it's finally happening. So the opioid working group is putting together some information about harm reduction and trying to introduce that. And so a draft of information sheet will be going out soon. And so you might see it at the last meeting. One of the things that was suggested is it has a lot of information about like what harm reduction is, like where are we in Berkshire County, what harm reduction is, how it's helpful. And so it will be a good resource for if we start talking about harm reduction in our own towns. And then the last thing really has to do with working with the medical professionals to find out what types of things that we can do to support them. So there's actually a lot of initiatives going through that South County Opioid Working Group. I know that some of you go to that, and I'm happy to include those notes since because I'm the so a lot of it comes back to us as far as the work that we're doing. And I want to make sure that you guys are kept abreast of that work. So I'm asking the group, is that something that you would like for me those notes to include for you guys, just so that you're kind of aware of what's going on, especially right now, since we're really talking a lot about the opioids and the initiatives that we're doing in South County. And I did want to let you kind of know that the Recovery Center actually was an initiative of this group. So
Jane, I think that's a great idea to, I see another hand waving in agreement. Right. I think the more information we have, and it's a very active group that's been going for a while, so I think it would be beneficial for us to keep track and see how we can interface.
Right. On that note, I will also distribute to the group the group lists, and I'll put that on my follow-up. So I'll send out the opioid working group notes, and I'll send out also contact information for each other so that you'll have that as well.
Great. So we know who's engaged, can go directly to some if we want.
Mm-hmm.
The last item in that group is the URL for the collaborative.
Yeah. Actually, I didn't loop back around. It's kind of been a crazy month. But just in general, so what would be nice today is just in general, does the group have strong feelings about having our own URL? And then would they be willing to give me permission to maybe work with the leadership of the group, so Pat and Rebecca, to just choose one and move forward with seeing if we can get that established. Is that okay with the group?
It is with me.
I'd like to make a motion that you guys move forward with picking a URL and letting us know when we can sign on.
All right, I will second that. Any further discussion on the topic?
Mm-mm.
All right, so I guess with several people on the phone, we do need a roll call vote. I'll do it in the order you are on my screen. Ellie?
Yes,
I will say yes. Jane?
Yes.
Jim?
Yes.
Diane?
Yes.
Mary Beth? Not quite a member, I guess. I'm not sure.
No, she's not.
Amy, do you count as a member also? No, I think not. Who is phone number 3?
So we have Ellie, me, Jane, Pat, Diane.
Jordan,
Jordan's from New
Rebecca.
Marlboro. I don't know who
And Rebecca.
Right.
and
Rebecca.
Rebecca.
I'm not sure who the iPhone is.
I don't have an iPhone on mine, unless it's Smitty.
No, it's someone.
No.
I'm not sure.
Oh, I see.
Switched
Yeah.
from my phone to Zoom, so maybe it's just my phone left up there.
You in
But
2
anyway.
forms. Okay, Rebecca, I didn't call on you.
I
Great, okay. Thank you. That's unanimous among the members. We will take care of that item.
Great.
Public health nursing. Oh,
May I ask
Jane?
who's
Ma-
Steve
ma-
Rubens? For Steve Rubenstein. Hi, Steve. May I ask who your representative-
I'm a member of the Sandersfield Board of Health.
Oh, welcome.
Welcome.
Hi.
Hi.
Madam Chair, we do, I don't know what version of the agenda, but the one posted does have a section D under new membership town updates. If I can give an update on that if you want.
Community partner updates? No, that's different.
I'm looking at section D.
Yeah, well, there was different versions of the agenda, but the official one that was posted has Sandersfield on there. So
Right.
as the collaborative, we've spoke about this before. Nice to meet you, Steve. I've been kind of communicating with the town, the select board chair for a while now. And so a few months ago, as you remember, the PHE funded communities encompass 10 towns in which we're getting funding to provide public health nursing. And so as we evolve over time, other towns are beginning to approach us to see if they'd be willing to join the collaborative. And I know there's some challenges with that from a funding perspective, because picking up other towns without the necessary or sufficient funding lends itself to some challenges, and we've been working with the state on that. But we have been going back and forth with the town of Sandersfield with the select board chair, I think, and about the opportunities about us picking up public health nursing, contact tracing, flu clinics, and so on and so forth. And I know they're sorting out what they want to do, whether if they're going to stay with the alliance or withdraw. And it's sort of like there's no decisions being made on it. But, speaking with Amy and Jill kind of down the road, it makes a lot more sense having some of these other South counties be part of the formal collaborative, just for the sheer issues of sharing school districts, for example, contact tracing. And so we've been kind of going back and forth. They're not sure if they're going to keep a contract with the alliance through FY23, but what I suggested to the chair the other day is like, well, it sounds like the select board and board of health have a lot to talk about. And so it already takes you a year if you're considering withdrawal anyway. So it would make sense to stay with them, so that just for continuity purposes. And then as we move along, and if things make more sense, plus we'll have a better idea in the fall, right, Jane, about this big needs assessment that we're going to be doing, which may come with a lot more funding, plus a lot of ARPA money coming. So the money could be available, for these other outlier towns that are interested further down the road, that wouldn't impact the capacity of Amy and Jill in the collaborative. We will be adding to that pool. So it's just nothing to really vote on. It's just dialogue happening. And I know Tyringham's not on there, but we will be presenting sometime in July to Tyringham what the collaborative is. And again, Tyringham shares the same school district as Lee. So we wouldn't, like Amy and Joe would be contact tracing half the school and then not the other half. So it would make sense regionally to figure out Tyringham, but that's all I have.
Great,
Thank you.
And I'm sorry that I was looking at the wrong agenda. I hope the rest of it is correct because I don't see where the
It's
new.
correct.
Okay.
Steve, did you have any questions? I mean, you're more than welcome to join the meetings. We meet the second Friday of every month, and it's a pretty robust group. And again, we got the PHE grant for 10 towns. And so we get, X dollars through the collaborative. And you're more than welcome and to join our group every time you want. We do meet on Zoom and in person, and we record. And if there's any information you're looking from the collaborative on what we're doing, please let me know.
I certainly will, and I thank you.
All right. Thank you very much for that update. Public health nursing updates. We have both of our nurses on. Whoever would like to take first shot, go ahead.
Just keep it short and sweet. We have some good news the last 7 days as of yesterday. Cases are down by 1/3 for COVID in our southern Berkshire as well as the county overall. So we're still in the medium CDC's grouping, but things are looking good. We are still distributing masks, KN95 masks, and at-home test kits around South County. And actually Sandusfield, Steve is on my list to get some out to your Council on Aging at the very least. That is part of the rural health networks. We're partnered with them, with Deb Phillips, on a grant that gives us resources to distribute those around South County, not just our collaborative towns. So that's been going well. And I had informally talked with pharmacists in the area to see what it was looking like, because at different points, as some of you may recall, last fall, nobody could buy a test to save their life. There were just, people were getting them at night when the shipment came in, waiting in the parking lot at Walgreens or whatever. It was crazy. And we've been through ups and downs. The current situation is that, well, since early this year, everyone is supposed to have been eligible for free tests from their pharmacy if they're insured. And then of course the federal government had these, mail tests coming to people. But what's happening because of the staff crunch with our local pharmacies is that they haven't been able to, and I guess they've gotten some pushback from the insurance companies too. So that those two together, they have not been allowing people to receive test kits for free. They've been requiring them to pay up front and then submit their own reimbursement, even folks who are on Mass Health, even folks with Medicare. So this has been an issue. This is why we've been prioritizing getting the stockpile of test kits we have out into the community. And we are, out of the 1,000 that we were working with, we're down to about 200 now. So we've been doing that a lot lately. And I don't know if everybody on this call who's part of the boards of health has done this, but all the towns are now eligible to receive more test kits from the state. And of course, you'll distribute those as you wish.
Thank you. Jill, anything on schools or programs that you're engaged with? I know you're doing car seat stuff.
Not much with the schools. I haven't received many phone calls from them, but car seat update. I did get the shipment of the state grant car seats. 50 of those showed up at Tri-Town one day. I had no warning whatsoever. So that was a shocker. And then I did get, I was awarded the Toyota Buckle Up for Life car seat grant. So I'll be receiving 50 booster seats at some point this summer. I'm not sure when. I have to do a training. They have specific guidelines that you have to follow for them. But I did install 4 car seats on Wednesday. So yay. Thanks to Jason Dragnetti at our office. He got the word out, and a couple of ladies that his wife works with, he told them, and yeah, so spread the word. I am going to work with John Kroll. We're going to do some flyer and a brochure to get out to different organizations, pediatricians' offices, VIM, hospital, you name it, it's going everywhere, and social media. And then I'm going to do a podcast also. And that will go out on social media. So that's exciting. I'm really excited when I get this up and going and get these car seats out the door.
And Jill, do you mind giving just a quick update what the program is? Because I know there's some new people at the table. I know Clarence Fanto is on the from the Eagles on the call too, on what the actual program is and the certification that you accomplished.
Right. So last September, well, when we first started this collaborative, identified there's nobody doing installs, inspections of car seats in South County. I know Pittsfield and, some northern Berkshire County places are doing them, to keep these little kids safe and in car seats and in the back seat as long as possible. So in September, I took a class out at East Hampton Fire Department. It was a 3-day class to properly install car seats. It's education for parents to teach them how to put car seats in. Back seat is the safest, rear facing as long as possible. Don't put your kid in the front seat until they are at least 13. So it's education. That's a huge part. And I know it's lacking. When I was pregnant 18 years ago, I had my first car seat installed at the Great Barrington Police Department. And then I got pregnant with Colby and it wasn't being offered. So I feel strongly about child safety, especially when I was working at the school and I'd be out in the morning for drop off and you see kids heads out the sunroof in the front seat without a seatbelt on. They're, second grade and under that are riding shotgun. It's pretty scary. So yeah, I'm excited.
Yeah, and that's definitely a need in South County. And in interim, the staff and I spoke the other day is, we're going to do a bunch of flyers and brochures to really push the messaging out. But as an intermediary, we're just going to throw a quick kind of document together to try to get it on the Tri-Town site, and we'll send it out to the collaborative towns on what the nuts and bolts of the program is until we have time to fine tune everything. Because the goal is to get this stuff out the door. Not to stockpile car seats, because there's a significant need for that. And, really partnering with CHP, Fairview, and the hospital and other organizations, and they'll keep Jill busy for a while.
Yeah, so people, on there will be my email address that they can email me to make an appointment. If they're only available on the weekend, they're available on the weekend, and I'll meet them where they're at. So
Jill, very quickly, are there requirements for participating in this, economic levels or anything, residencies?
So the state funded one, yes, the car seats that I have now, we're supposed to, meet the low income families. I don't think there's a financial requirement for the Buckle Up for Life one, which will be later this summer. So yeah, I'm not asking, are you low income? I'm providing seats as needed. The one I took on Wednesday, it was a used seat, like third time used, and mice had gotten to it and had chewed away at the straps. And I'm like, she's like, oh, I'll give this to my husband to put in his car. I'm like, no, I have another brand new seat for you. I'm gonna recycle this for you. So I cut the straps and took it all apart and destroyed it basically and threw it in the dumpster. Just want to make sure these kids are safe.
Terrific. Thank you.
You're welcome.
The next item on the agenda, yes, please.
Sorry, just a quick thing. Again, getting information out. I was just thinking about kids and car seats and reminded me. So next Wednesday, we're expecting the COVID vaccine for the 6 months to 4-year plus group to be approved. So just so folks know, I saw a flyer. CHP is already planning to roll that out as soon as, I don't know what date. I know the 21st of June could be the earliest that it's available. I don't know if they'll actually be doing it that date, but they already have flyers going out to future clinics. And then the other thing I know, as of tomorrow, the Fairview COVID vaccine clinic has appointments for 5 to 11-year-olds to get their booster. I guess they just were able to update their registration system for that. So spread the word, get these kids caught up, join the rest of us in the vaccination pool. So
Thank you, Amy. Good. Okay, the next item is community partner updates. I don't know who's got that one.
I think this was just to let all of the board, to report anything that is going on in their town, and it's a nice foundation agenda item for discussion.
Okay, good. Anybody want to share anything that's happening, especially positive things? I know that Ellie was sharing something more complicated earlier in the conversation before the meeting started, but anything that you'd like your colleagues to be aware of that's happening in your community or looking for help with anything?
I don't have anything to report. I think, obviously the opioid pooling is a big priority for us, and we're trying to navigate that. And just from my perspective, everything's going really well. We're not at the new normal yet, but things are opening up, and I'm just really blessed to have such a dynamic staff and a team to be working with constantly. I really feel that we're making a lot of inroads in South County, and just exciting times. Thank you.
Any other comments? Yes, Jane.
So through the town of Alford, Housatonic Valley Association tests the Housatonic River watershed, and those tests are going to start next week. And one of the issues we had last year is two reasons. One is they only get tested every other week, and then the second thing is that we weren't getting the results as timely as we would have liked. So anyway, Alford is filling the gaps. We're going to do Green River right before it goes into Egremont, and then also the Alford Brook. And so what I'm hoping is that through that partnership, we'll get a timely report on the every other week. And so for towns that have streams that are tested in there, it's just a good idea to keep track of it, especially things like the Green River or where people do a lot of wading. So you might be seeing some information coming out from me. And the reason why it's coming from me is it will get to you in a more timely manner, hopefully.
Jane, is the Concapot done in that series of tests?
Yes,
Yeah.
actually, I got trained on how to take the sample the other day, and we did it on the Concapot.
Great, good. Okay, any other updates? Yes. You're muted.
I was just thinking while you were talking, Jane, is that one of the other areas that needs to be included in that is Gilder Pond. We do have a major problem with that because officially it is not a swimming area. However, DF, or who is it that does that? The state park people will not enforce it. And we can have up to 30 people in that water. And I personally was chasing people out who were changing diapers and letting their kids swim in their diapers. So it's not very fast moving water. I know, again, Mount Washington loves to be its own independent, stupid self sometimes, but the state's not helping us with that. And my feeling is that if it is not a swimming area, then it should be their responsibility to enforce it. But
So is it owned by the state?
It is owned by the state. It's Mount Washington, it's Mount Everett State Park. And but they're not enforcing it. So if we can get water sampling there to show them that we need to deal with it, would be great.
I can certainly mention to Housatonic Valley Association to see if that's something that they were interested in. The other thing is like Alford is just, we're sampling it ourselves and we're bringing it to Ecolab ourselves. And I think it's like $75 a sample.
Right.
So,
well, I did it 3 times last year. And the town paid for it, but it's not going to happen again because they're not going to pay for it because it's state property.
Yeah.
Great.
Thank
Another
you. Sorry.
complication. No, that's okay. Good. Good to be aware. Any other comments by members or others? Okay. The upcoming training, upcoming conference, and in October, is it at the same location, Jane, Jim?
Yes, I think.
Oh, wait.
I don't actually have the agenda in front of me. Which conference is it?
The
MHOA?
MHOA conference.
Yes, it's going to be at the same location. I think it's going to be a good one. I'm the chair of the food track. And so we're hoping to have some interactive things for people, especially new inspectors, to kind of learn about. So yep, it's going to be at the end of October. They're just starting their early bird, which there'll be a substantial discount for registration. And I think what we're going to do is that this year, going to do it at the same location and then really ask the membership if are they happy having it at the Cape. There's an alternate site they've been looking at, which has its pluses and negatives. And so we decided to just go with what we know works this year and ask everyone what they want to do for next year.
Great, thank you. So unless there are other items, the next item is setting the next date for the meeting, which is July 8. Unless that's a hazard to anyone coming off the July 4th holiday.
Yeah, and I'll let everyone know if I'll circle back with Rebecca to see if we can get some space again in Great Barrington. I'll let everyone know and we'll go from there.
Rebecca's right here. She said, yes, we can be here.
Oh, good.
Great, terrific. You're now her secretary. Is this?
I am. She literally walked past me.
Great, okay. Any other business that anyone wishes to bring up? If not, I will thank you for your attendance and participation and entertain a motion to adjourn.
So moved.
Second, okay, moved and seconded to adjourn. And I think we'll just raise our hands and say, yes, let's have a great weekend, everyone.
You
Thank
too.
you, Pat. Thanks, everybody.
Thank you.
Thank you.